my name is Shiva Patel. I'm a transplant fellow at Baylor University Medical Center in Dallas, Texas. I first got involved with the cardio nerds through the first iteration of the Fit Trialist program, thanks to Dr. Hall, who was the PI of the Paraglide HF study in the Dallas location. And after that kind of dipping my toes into the cardio nerds world with that, I really just kind of took on a lot more opportunities just because I really enjoyed the energy that the cardio nerds community brought. And so when I had the opportunity to kind of shape the subsequent iterations of the Fit Trialist program, I definitely wanted to be a part of that. And so today we're going to be talking about professional and personal development. And so this is kind of a topic that I think is, you can't find it in a textbook. You sometimes have to be lucky to get the right mentor to tell you these things and just happen to be in the right situation to get this advice. So I really think this is an incredibly valuable session for you guys to get some concentrated advice. And obviously when I saw this topic on the curriculum, I thought of Dr. Hall immediately. So just to give you a brief background, Dr. Shelley Hall, she's the current chief of transplant cardiology and mechanical support at Baylor University Medical Center. She's a associate professor for the Texas A&M Medical School. She's the current president of the Texas ACC chapter. She's also the founder and president of Women in Heart Transplant and Mechanical Circulatory Support, and has been really active even in the Texas chapter about promoting women in medicine. She's associate editor of the American Journal of Cardiology and also of the American Journal of Transplantation. She's a former president of the thoracic COP at the ATC or ATS, AST, and she's now moved on to be a board member. She's also been continually involved in UNOS, currently going to be the chancellor-elect for Region 4, kind of determining policy. And all along while doing this, she's been PI for multiple clinical trials in the Baylor system. And what I think is most impressive is how she's been able to balance these leadership positions with a personal life where, she's had, I believe, 5 children that she's raised and all through residency and training. And also, is someone who is able to balance the stresses of work with, relaxation in her personal life and just someone that is a great role model for us to learn from. So this may not be narrowed to the scope of a clinical trialist, but I think it's going to be great for us to understand kind of the roadmap on how to go through fellowship and early career in terms of developing ourselves. So with that, I'll leave it to Dr. Hall.
All right. Wow. Thank you. Thanks for having me. I'm excited about this. I really want it to be interactive in Q&A, so hopefully I'll keep the slides pretty to the point. I presume, am I going to share? Is that what we're going to do? Okay.
Yep. I've enabled it.
All right. Let's see if it's not file. No. All right. Well, we'll try and do the desktop way. I don't think I have anything too incriminating to show because that's not working. Okay. So let me open this and you tell me if you can. Let's see, slideshow. All right. Do you see all that?
Yeah, we're good.
Okay, cool. All right. So what I'm going to be talking to you about is the transition from fellowship in those first couple years. As Shiva said, there is no textbook for this. Okay. And I think sometimes very unrealistic expectations are in your minds about what you have to do in those first couple years. And I'm hoping that I can alleviate some of that. And, Shiva was kind to mention a lot of things that I've done, but I've been in practice a long time. And I didn't accomplish that in the first couple of years of coming out of fellowship. So what I call that transition is holy shit. I mean, that is one of the scariest transitions you're ever going to go through. And you should know that. And that's normal to feel that way. So how am I qualified to talk to you about it? Well, now I've been in practice nearly 27 years since my fellowship, 26 and a half right now. And I've seen a lot of stuff in those years. Probably not everything, but almost everything. A little bit about me. I grew up on Cape Cod, Massachusetts. I moved to Texas for college. My family had nothing, and I got a full academic ride. So that's how I got to Texas. And I never left. I truly was a Texan just waiting to get back home. I got married in college, divorced in med school, and had one kid from that marriage. I was a single parent in residency, and then I got married again. Pregnant and gave birth in every phase of career. So I have 5 children, but I only birthed 4 of them. So one in med school, one in residency, one in fellowship, and one in the first year of practice. All my medical training was at one institution, and there are pros and cons to that you all may be noticing. And then all of my lifetime of practice has been at a single institution after that. So that's unusual in today's world. I've gone through 4 surgical directors in my career here, and I've had at least 20 colleagues, and I've lost one to suicide. And I'm still here. So, I mean, that alone gives you kind of an idea of things that I have lived through and can answer questions about, concerns about for any one of you. So the first thing I'm going to talk about is just that first year. So I break it up in the first week, the first month, and then the rest of that first year. So first week, it is all about learning the system. Most of you will not stay at the place where you trained. So you may be learning a completely new electronic health records. You need billing training. Nobody teaches you billing training in your fellowship or residency. And so you need to find out how to bill because the world revolves around billing, okay, and RVUs and all of that. Seek out the non-physicians in that group. Reach out to the coordinators or the nurse practitioners or the department managers. They love to be recognized. They know all the secret passages and all the secret ways to do things. And that you're showing you want to know who they are and what they do, and asking them questions will make them your best friends. And really watch and listen. Okay. I think every program, when they start a new attending, should have them shadow. And that's what we do. Not a lot of places do that. But I think the more you watch and learn and listen, the better off you're going to be in that first year. So first thing is, don't assume that the EHR, just because it's Epic, is the same as what you train. For as many systems as there are versions of Epic. And that's what I've learned. So there may be things very familiar, but there may be things totally foreign. So you're going to have to go through some EMR training. And if they don't offer it, ask for it or buddy up with somebody to teach it to you. Learn all the team templates as quickly as possible. Hopefully your teams are efficient and have lots of these, and they've hooked you up with some kind of a mentor, and download all of those templates to make your life easier. Learn how the team flows, how the division of labor, especially if you've got split billing with APPs and yourself as the attending. Take lessons from the NPs. They're the masters of structure. And if you learn how they do it, you'll learn the most detailed version, and then you can graduate to the attending version of complete, quick shorthand and on your way. Billing. Do you know how to bill? Very few graduates know how to. How do you document properly to get the maximal billing, but with being most efficient so that you don't write, a 2-hour book to get a level 3? None of us have enough time to write everything that's needed. So knowing all of the key words and stuff, that you can do it in the most brief time. Communication with your billing department is going to be key. If they're not offering you training, demand it, ask for it, find a way to get it. RVUs, as I mentioned, are the way everybody is measured nowadays, and it's captured through billing. So if you don't document well enough to get the maximized billing, then your RVUs aren't going to reflect how hard you work. And in my space, advanced heart failure, we have the lowest RVUs, and yet we have the most time-consuming patients. And so it's incredibly important to learn how to do that documentation. Know your contract. Okay. When you start to go through the phase where you're applying for jobs and looking at your contracts and looking at RVU requirements and things like that, talk to colleagues that you've known that are 1 or 2 years out, or if you've got somebody that you know well at the institution you're applying, and look, the ACC MedAxiom posts this information. So if you're an ACC member, you can get that to know what are the average RVUs and salaries in your space in the different regions and the specialties, so that you can take your contract and look at all this information and make sure it's fair. It's never as much as we want. Okay. Never, never. I don't know of anybody who's turned down, oh gosh, that's too much of a salary for me. I want less. But you want to make sure it's fair. Coordinators are your ally if they like you. They are your enemy if you don't. So if your coordinators are happy, you are happy. And what I mean by coordinators and NPs is, in my space in transplant, advanced heart failure, we have coordinators that are involved in the management of patients. Most cardiology practices are going to have NPs. Coordinators are usually nurses and then NPs. And they have various levels of responsibility. Every practice works with them differently. Some are, I think, underutilized as simple scribes, but they can be your eyes, your ears, your hands. They can be your most valuable tool for being able to maximize your ability to work, minimize the amount of time you have to spend on the EHR because they're doing that for you. And they're also catching gaps. So listen to them. Don't talk down to them. Like I said, those first couple weeks when you're meeting and getting acclimated to your new place, make them your friends. Be interested in them, learn from them. And if they sense your engagement, they are usually very thrilled. Befriend them. Watch and listen, as I said. Watch how ICUs flow. Just because you did it a certain way in your training does not mean that is the way it's going to be done at wherever you start your new position. So don't walk in there going, well, the right way to do this is how I learned it, blah, blah, blah. That's the quickest way to piss people off. The more you say, well, at my institution or oh boy, that does not go over well. So watch and see how your team does it at your facility. Um, uh, Again, engage with the floor nurses, and they can make your life miserable or very happy. And P's, as I mentioned, clinic flow. Okay, no clinics are efficient enough for us. EHRs slow it down, and clinics are all about turnover to try and maximize RVUs. So looking and learning as quickly as you possibly can how the clinic is flowing, whether it's office or clinic. We use the term clinic when it's hospital-based. If it's outside the hospital, you tend to say the term office. But watch and learn how that flow is so that you can become as efficient as possible, as quickly as possible. And then watch your partners. Watch the ones that have just been there a year or two. Watch the seniors. Watch how they're doing things. Identify a lot from that will be who your potential mentors are going to be, and in the practice. So in the first month, again, I advocate for 4 things. Shadow as long as you can, learn who the players are, watch the culture and team dynamics, and identify a mentor or confidant in that first month. So shadowing, does the program that you're about to join offer shadowing or any other transition methods? I think these are very important, very useful. With our program, we have rotation. So there's 11 transplant cardiologists. We rotate a week at a time. And each week is a different thing. And so we actually have the new attending rotate through about 7 of those. Because there's like 3-4 weeks of clinic and 1 is an off week. So you only need to rotate 1 week of clinic. But that way they get each a specific rotation and they just partner up with their partner that's on that week and they learn and then they start to do things. And then when they launch as the official attending on their own, they're much more comfortable. They've learned the system, they've learned the process, and they've had that transition between having an attending over you to nobody over you. Learning the players. This is a big one. Who are the alpha dogs in your group? Okay. And how does that relationship work? There will always be these kind of social dynamics. You can have the most functional or dysfunctional group, and they can hide it from you during your interview process. So who are the alpha dogs in the group? Who are the worker bees? And they're equally important members of an entire group. Can't have all of either one of them. Who has special skills that you're potentially interested in, either that you already have and you want to maintain or you'd like to pick up as a partner? These are all things to look at in your group dynamics. Culture is huge. It is ultimately why you leave or stay 90% of the time. You can have all the great academic stuff. You could have all the procedures you want, but if the culture doesn't work for you, you're going to leave. So do you operate in silos, or is it a well-oiled team? Does everyone do everything, or is it very separated in what people are allowed to do? Are you allowed to expand beyond what you completed in fellowship? What is the night coverage and the weekends? We old timers, of course, and the old timers before me said the same thing. You guys, your generation is lazy and you don't want to work anymore. And in my day, we were on call every day, all day. We never slept. We never saw our family. It has definitely gotten less and less over time, and that's why each generation says that. Um, but it's important to understand how your group and how your patients are covered on nights and weekends, and that it's fair. I mean, there are some groups where they're top heavy, like, all the new employees have to have twice as much, or certain people get out of it because of who they are. And so, looking and asking, those are important questions to ask when you're applying. The patients need to be cared for on nights and weekends. So don't expect a job where you're not going to do that. Certainly not at the same pay. And they tend to be sicker on the nights and weekends, and there's a lot less support for those patients. So there's a lot more pressure on you when you're taking care of patients on those after hours. How do you interface with the NPs? How are they utilized? Are they happy? Are they unhappy? That will be very, very important. And then identifying a mentor. So what are you most in need of? And that will change over the first year and subsequent years. So just because you identify a mentor for a certain thing in the beginning may not be that person mentor for you throughout your entire time with the group. What are your future career goals? Do you even know? Are you right now just wanting X and then not thinking about anything else? Or do you have a whole bunch of things you want to do and you want to start them yesterday? And so, you may need different mentors for different objectives. Your personal objectives are very important as well. Some people are workaholics. Some people want to always make sure that they have enough time for their family. Some have recreations or other things outside the job. Those will factor into the type of group that you join and the practice that you develop. And so you may need a mentor for life-work balance, and then somebody else for research initiatives, or somebody else for how do I deal with a difficult colleague. All of those resources don't come in the same person. So the rest of the first year is, again, learning and playing by the politics of the group and the institution you've joined, going through that transition from fellow to attending, and continuing your training and learning. You're going to be continuing to learn. You are not going to, you may walk out of your fellowship thinking you know everything, but you don't. And then in my experience, when I graduated as a fellow, there was no cell phone. There was only the pager. You had to stop at a payphone to answer it. There was no electronic health records. There were no Impellas. There was no peripheral ECMO. Trying to think of other stuff I do nowadays. I learned all of those things in my career. Okay. So you are always going to be a lifelong learner in the space of cardiology. And then when to do more than patient care, which is all of these other things we're going to talk about. I always emphasize to my first year partners that they focus on patient care. And the first 6 months, I won't even let them volunteer for stuff. because you've got your ultimately your reason that you graduated and are doing this is to take care of patients. Otherwise, you wouldn't have joined a clinical practice. And so the best thing you can do for your career is be a great clinician, and everything else will fall into place. And then you're going to go through a lot of personal stressors that first year, whether you are single, whether you have a partner, whether you have children, whether you have pets, whether you have chronic illnesses, you name it. There are going to be things that happen to you in that first year during that transition that you're going to have to manage. So the politics, again, the hierarchy, what type of empowerment do they give you in the team, in the hospital, in the system? Are they physician friendly? Are they physician hostile? Or do you notice problems with gender or diversity issues? Looking at all of those things, you're not going to necessarily identify all this during the interview process. So you're going to be watching all this the first year, because the goal would be to be like me, and that you chose right and you stayed at the best place for you for your entire career. Okay. What practice type? The change is what I call that transition from fellow to attending. So the first thing is fake it till you make it. You're going to be so filled with self-doubt. Am I making the right decision? Am I doing this properly? Oh my gosh, I'm not ready. Outwardly, just fake it till you make it. Okay. For your patients and the nursing. Okay. Some nurses will eat you alive if they identify your indecision. That's where you find that mentor, that person you go to. Can I run this patient by you? I mean, all of my attendings can come into my office at any time or text me. Can I talk to you about this patient? It is absolutely okay to ask for opinions, but you're going to have to figure out the politics and the environment and the culture to see how that works best. Every group is going to be a little different. And again, remember that your training is not the only way to do something. That's given you the bedrock for you to develop the muscle memory and the mental memory, but ultimately you will learn as you see more and more patients that there are more than one ways to manage a particular situation. As I mentioned, continual learning, ongoing education should be part of your group, internal and external. Look at the different ways your partners are doing things and adopt some of them. You may find you like some of those approaches better than the way you trained. And so be very open to seeing new ways to do things. Keep up with new publications that can impact your program or your career. We are buried now in literature. I mean, if you haven't seen the latest paper through Twitter or LinkedIn, you're behind. And by the time you actually get a paper journal, if any of you still receive that, it's been online for months. And there's just too much. You will feel yourself drowning in it. So you've got to ultimately pick and choose. So pick what is actually going to be important to you right now. You got to kind of get out of that fellow mode that I've got to read everything and I got to be up to date on everything. Really focus it, because there's too much out there. You get too much else to do. Beyond the clinical, okay, most of you, if you're involved with cardio nerds, it's because you're interested in being in research, and that's awesome. But as I mentioned at the beginning, really those first 6 to 12 months should be all about clinical care. And then talking with your mentor. With our group, we assign a mentor to each new attending. And I meet with them monthly for their first year, and then quarterly for their entire career. As well as any time they can just say, hey, can I talk to you about something? But they may also then click with somebody that they really want to talk to about some of these things. And they've got that opportunity. So you're going to be looking for different people that trigger, that speak to you on these different things. So research, teaching, residents and fellows yourself, speaking opportunities, and advocacy or policy development. And those things can develop. Again, they don't all have to happen. One of the things is, when I've shared my personal story, is when I left my training, I was pregnant with the last kid. And I was like, there's just no way I can do everything. And so I said, well, I'm giving up research. I'm giving up academia. I went to Baylor. It was a massive clinical program. I got 5 kids. I'm not going to do academia. And I went through a mourning period because I went to an academic institution and I trained that way. And then about 10 years in, I became leader. I was a leader now, and I was molding everything. And I saw I had a vision for the program that could be done if we made some bold changes. I ultimately convinced the hospital to do it. And all of a sudden, the vision I had came to fruition, and we really exploded, and now I do tons of speaking, and I do all of these things, and I wasn't doing anything except teaching beforehand. So you don't have to do all of these things at once, but you can do all of them throughout a span of a career if you wanted to. So how do you start to think about those things outside? So I broke this into a couple areas: professional societies, how to crack the code. Okay. So what does that mean? So the first thing is you're not going to get invited if you don't join. Okay. So you do have to put yourself out there and join professional societies. There are a lot of them out there. So ultimately, you've got that nice transition from fellow salary to attending salary. And now all of a sudden, all these memberships aren't so as onerous as they were as a fellow. But picking and choosing which professional societies you want to join. And then within each of those societies, they have interdisciplinary networks that are going to speak to something particular. So you're going to want to get into those. Yeah, that one and this one. Reply as these societies put out blogs and posts and emails. If it's something you're interested in, reply. Sometimes it can be just an opinion. Sometimes it's a call for a volunteer. But again, in the early years of your career, nobody knows who you are. And so if you want to get, involved and get on podiums and stuff like that, then you start by joining the society, you reply, you then volunteer to do something. So it may be reviewing abstracts for a national meeting. It may be writing a blog or something. You volunteer for something small, something that you can turn around, and then you want to turn around on it. The worst thing you can do is volunteer for something and not complete it. So I always say start small with low expectations, things that you can do, and then you start to build a reputation. And then you can get, a lot of people want to speak on the podium at these societies. Well, the way you get on the podium is that you submit symposia to these societies like ACC. They don't have a bunch of guys in a back room that create this agenda. They ask all the members, send us your symposia ideas, and make sure you have the topics, the speakers, the alternate speakers, the moderators, the alternate moderators, their emails, and you submit it all. And members pour these things into the organization. And then there's a steering committee that sorts through all that and goes, yeah, I like that one. I like that one. Those four are pretty similar. Let's combine them. Nah, I don't like that one. That's what the steering committee of a professional society meeting does. They don't create the content, the members do. So to get onto the podium, you need to be part of that process, creating a symposia with yourself in there. And then the first time you're on a symposium and on the podium, you want to do well. Because then when people develop next year's, they look at last year's and go, oh, I remember that. Or, oh, that person spoke on that topic and that's the one I want to do. I'll put them in. And it self-perpetuates. And that's why you will see the same people on the podium year after year after year, because that's how it's built. You got to be persistent. You're not going to get necessarily into things at the beginning. Again, volunteering for small projects and working yourself up over the years is the key. And then whatever you do, finish it on time, if not early. Start small and you will rise up if you want to. So there are lots of meetings out there. So how do you choose? Okay. And I kind of broke it down into the why, where, when, and how. So why? Why are you going to a particular meeting? Are you speaking? So that's nice. Then the big question is, are they paying for you? That's even better. Are you going, you're not a speaker, you're just going for the content and you don't really care about CME or whatever, but are you going to get a CME or MOC or all of the other acronyms out there now? You can get CME anywhere and you're starting to get MOC everywhere as well. So there are lots of opportunities to do that virtually on your computer at home, but also you don't want to live on your computer at home. You want to get out. Or you go into a meeting because you really want to connect with others in your space or future mentors or leaders that you've really wanted to get to know. And getting your resume out there. Okay. You've had the first couple years, or even now as a trainee, you're trying to search and see what programs might be good for you. Developing these connections, these meetings and following up with sending them your CV, are going to be ways for you, to connect. And every time you're presenting, whether it be a poster, an abstract, or on the podium, you want to add that to your CV. These meetings are resume builders. Where, okay, we all like nice locations. My background is my favorite place to be, which is a beach somewhere. And so, it's okay to choose a meeting because it's at a great place, and your plan is to be at a meeting for 2 of the 3 days and combine it with some personal time. You do have to investigate the policies of the group you've chosen. A lot of hospitals, if your hospital base have become much more restrictive, like our hospital will even restrict the flight. Like the flight has to be, the day before the meeting and the day after, which is craziness, right? That shouldn't matter. So you have to just make sure and double check what the policies are about going to meetings with your group. You may be going because it's near family or somewhere where you love to go. Whether it be the beach or, the mountains or the ski. Mm, and that's okay. You need some R&R, and if you can combine it with as a mix of science and fun, that's even better. When? Is this gonna be during your training time? Is it gonna be during your work time? So it's gonna be PTO, or is this gonna be on your personal time? And that's gonna vary for you, but you gotta look and find out what your policies are in your new group. For do you get CME time? How much PTO do you get? With our group, there's some CME time and PTO time. When you're single and no kids, a lot of times you want to max out the work and you do these things on your personal time. But once you have a partner involved or kiddos, it's sometimes you're like, okay, we're taking off this week and the meeting is 3 days and we're going to combine it with a long weekend, and it's going to be a combination of work and family fun. And then ultimately, how you go to a meeting is important, and both as a trainee and when you become an attending. Who's paying for it? Okay, these things add up. They're not cheap. How long is the meeting and how much is it eating into your PTO? And can you bring family? One of the things that we do with Texas ACC annual chapter is try to choose a location where it's good to bring family, so that they can combine the two. Um, then when you're at the meeting, you gotta look at where you're staying, okay? Sometimes the extra hotel price is worth not having to take an Uber to, 15 minutes to the meeting, especially if you're wanting to go in and out of the meeting. How long are you planning to attend? Again, are you presenting? Are meals covered? Are they part of the meeting? And then the connections. These meetings are huge for building connections. And then after the meeting, it's very important that you share what you did and what you learned with the rest of your team. Because especially if you're doing this during work time, I don't care, we all go off on meetings, but the ones who are stuck back holding down the fort, there's this little kernel of, damn, they're there and I'm knee deep in this crisis. So sharing new information that you've learned and bringing that information back to your team, not just your docs, but your NPs, your nurses, et cetera, is huge. And it'll really help build the bond among your team that whoever is going is bringing valuable information back that helps the rest of the team. For those connection building, you want to make sure you follow up. So, whether it's the look at, grab my QR code or the good old, business card, you want to make sure you follow up and say, great to see you, meet you. Just wanted to follow up about our conversation, especially in your early career and you're talking to somebody more mid or higher career. They're going to be inundated and they may not necessarily follow up. So it really is up to you to follow up that contact. And then again, learning that incorporating those new things you got, or things may have validated what you're doing. One of the things I was so surprised when I started going to meetings is I thought, we were in the backwoods as far as how I did things. And I ultimately thought a lot of times I was way ahead of what people were doing. And what I thought was normal was actually very unique. So, that back and forth is important for your group. And then ultimately, the final thing is the personal life. My generation, it was the work-life balance. Now it's called the life-work balance. What I would say is it's both, and it's going to be reversing. It's going to be a seesaw. and depending on what's going on. So you may have a partner, you may have children, you may have a lot of outside work activities, um, and you have X amount of PTO if you're salaried versus if you're, eat what you kill RVU, then, the more you work, the more you get paid, the less you work, the less you get paid. And those are personal choices. Ultimately, it's your life and it's your choice. And so that's why the culture of the group is really important in trying to figure out, does that match your personal culture? And understanding, as I mentioned, just a little tidbits of my life, they didn't all happen at once. It was impossible. It could never have all happened at once. And so there are going to be times when your seesaw is very heavy on the family side or personal side, and you're going to feel like your work is you're slacking. Okay. I always tell when I talk to women, I say, as a working mother, just learn to live with guilt. Because at the hospital, I always felt guilty. I wasn't room mom or I wasn't going on X, Y, or Z field trip. And when I was home with the kids, I always felt guilty that I wasn't, creating some kind of a paper, or I wasn't, going to a dinner with the rest of the group because I wanted to see the kids before they went to sleep or things like that. That seesaw is going to be different for everybody, and it's going to be different extremes. And that's just life, and that's part of it, and that is okay. You're not always going to be happy. Everything's not always going to be perfect. It's going to be stressful. So that was a big overview of just sort of what I felt were important tidbits to share. And then I'm hoping it generates a lot of questions. So let me stop sharing. And Shiva, up.
That was really great, Dr. Hall. I just have two comments to kind of maybe start the discussion. Specifically, when I started as a fit trialist with the paraglide, uh, paraglide trial, I really learned about the importance of coordinators and understanding how the system works on every level, because the first two patients I tried to enroll, we could not get them in before they were discharged. And part of what it was is I did not reach out to the research coordinator beforehand. The research coordinator had turned over since the prior enrollment, so they had also not enrolled the patient before. And then there were steps that needed to be ironed out so that the process worked well. And so what that meant is I went to the research department. I talked to the research coordinator about what the steps are so that I could learn what she was doing so that we could facilitate these things. And so that applies to everything in your job, the way Dr. Hall described it. So that was something I encountered immediately upon trying to work with the fit trialists. And then in general, I've heard it described, I think, best as work-life integration, because you can't separate the two, especially as physicians. I personally um, talk about work at home. My significant other is also in medicine, and I told her that I could not be with someone who was not in medicine because I talk about work at home. And if they have a problem with that, there's going to be a problem in our relationship. So I know other people have other opinions on that, but I think of it more as work-life integration. For example, you get home from work, you've got work left to do, but you spend that time with family in the middle and you addend notes before you go to bed or something like that. You're going to have to find ways to balance life. And when you're balancing life, the same thing happens in work. Like, you're going to have to, when you're on ICU, there was a week where I was on ICU with Dr. Hall, and, I was not planning to do anything other than patient care, but it just so happened to be a weird light week where we were just consults on some ECMOs. And I got a bunch of research work done just because I had the time. And so you're going to have to ride these waves, like you said. And I think it's really important to understand that that's normal, because I think we expect it to be straightforward, but it's normal to kind of ride the waves.
I think it's funny you talk about a medical spouse because my husband's an interventional cardiologist and I hate to talk about work. Like, he's trying to be, more engaging and go, "Oh, how was your day?" And I'm like, "A disaster. We're fine." I just live through it all day. I don't want to recap it for him. And I don't want to hear him regale about the lesion that I just opened. I'm like, "I don't care. You're not that aggressive to me." Um, So we actually are the reverse where we're trying to like not. Now sometimes we love to bitch about something that happened at work. That's just normal. But so I agree there are no right or wrong dynamics for what you bring home and you know, obviously the reverse. Sometimes your personal life is going to affect your professional life. And it's important to have somebody that you can go to in the group that you've joined that you can go to about those things. As I said, I lived through a partner who committed suicide. Um, and I don't wish that on anybody. Because, you know, if he had reached out, would it have been different? So, make sure that you have those avenues with your group, that's that kind of group.
I'll say that
Dr. Hall,
my
thanks.
wife is. Oh yeah, Katie, go ahead.
No, go ahead.
I was going to say my wife is also a physician, and she also couldn't care less about the lesions that I fixed in my day. But I will say that so much of what you said resonated, but particularly in my moment right now is nothing quite prepares you for that first year out of training. And there are so many moments of like self doubt and this and that, but it really does help to have your allies, your mentors, people you can turn to. So I want to say that. But Katie, I'll turn it over to you.
I think everything you said about culture is really important and figuring out what the culture is before you show up there, making sure it's a place that you'd want to work at, or at least knowing what you're going into. But it's hard to assess on an interview day. Everybody has dirty laundry and they don't really show it. What are good questions that you can ask on your interview day that can help tease into that question of trying to get to culture without coming out and being like, do you guys all like each other? And then how do you ask about how mentorship is at that institution as well, making sure that they have set things in place and that it's robust, like you're talking about meeting with someone monthly early on before spacing out, and it's not that annual meeting that you'd get anywhere.
Now, those are great questions. I didn't obviously cover the interview process. So the first thing is when you're invited for an interview, you know, nowadays it's Zoom first, right? But ultimately, you know, you should go physically. And the first thing is when they're setting it up, um, uh, ask who you're meeting with and say, I'd love to meet with your nurses. I'd love to meet with the nurse practitioners. I would love to meet the office manager. I want to know the whole team. If they shut that down, that's to me is suspicious. When we interview somebody, they get alone time. Like none of us are in the room with the nurses, and none of us are in the room with the NPs. Um, and they meet with our managers and they meet with our admin, and so that we feel that and we do that on purpose. We tell them that, and we do that the same for fellows. When they're interviewing for fellowships, is we make sure there's time to talk to fellows without any attendings around. So, you know, you can get a sense of it through how they respond to those requests, which to me are appropriate requests. This is the group you want to join. You're not just joining doctors, you're joining that whole team. So that's a good way to get, you know, do this hairs on the back of your neck go up or down when that's set up. And then just watching, if they were strict, you know, you got a group of 20 cardiologists and they have you only interview with 2. Okay. Or they don't let you interview with the early careers, the young ones. Those are other kind of weird signs that you're, you know, only meeting with a senior person or something like that. That's what the first round was for. That's what that Zoom interview was for. When you physically are, you know, spending the money and time, or if they're paying for it, whichever, to go there and see it, you want to see the facilities, you want to see the hospitals, and you want to meet with all those people. And it's very reasonable to say, and you don't have to say, you know, you just say, I would love to meet, you know, the nurse practitioners that I'm going to be working with, or whatever it may be. You have to investigate that group and look at their websites and know how things function. But that's the way you get through that. And then there was a second question. I forgot it already.
How do you assess about mentorship that they have
Yeah.
set up for early faculty?
Well, if they give you, if they have you interviewing with junior faculty, then those are great questions with them. So how, you know, who helped you during your first year, who's the go-to person? Do you have a formal process? That way, it's not like you're asking the senior guy who's all crotchety and then go, boy, you need help, Um, but so talking to the young early career members of the team is probably going to be your best way to find that out if they don't mention it. Like I bring it up because I think it's important. I tend to run a very open book group. So, but that would be probably the best way to ask.
I'll just add in terms of culture, you need to look at the leadership because they're the ones that are going to create the culture. And then if you're going someplace relatively local, the device reps and kind of the pharmaceutical reps are kind of how you can outflank if they don't let you talk to people or there's some kind of blockade. Those are the people who are going to give you the honest truth because they're a third party coming in there and they love to gossip. So if you talk to them, what's the vibe over at this hospital? Or do you know anything about this group? The device reps, the pharmaceutical reps are a good resource to at least get some potentially honest feedback.
Yeah, I got a lot of truths from device reps. The caveat is the information does flow both ways also, right? So be good to your device reps. Um, there's a question in the chat. Sonia Abraham is a heart failure fellow at Northwestern. What are the common areas you've seen new attendings struggle with in their first months?
Yeah, I mean, most of it is just learning how it all works because it's different from where you were as a trainee. And so that imposter syndrome of, I really don't know as much as I thought I did. When your first sick patient really, crashes on you, and billing, which nobody teaches. I think those are the biggest areas, which is why I say that everything should be focused on just being the best clinician you can. Those first 6 to 12 months. If you're staying at your own institution, then you've got a leg up on some of those things, but there's a drawback to that, right? Sometimes they don't stop treating you as a fellow and you're not looked upon or treated as a partner, but still, like kind of that super fellow. So there are drawbacks to staying at the same institution as well sometimes, and you got to look for that and ask. Um, but those are probably the most common things I think everybody's going to struggle with at the beginning.
I appreciate it when you said that you don't have
Thank
to
you,
conquer
Dr.
the
Hall.
world in your first year out, that the career can span multiple decades and you have time to pace yourself. I think for the sake of time, maybe we have time for one or two additional comments or any perspectives or thoughts anyone would like to share.
Yeah, I wanted to ask, just in general, not just in academia, but you talked about making some big changes at certain points in your career that involved the hospital and things. How do you deal with the inevitable rejection, and how do you kind of regroup and refocus? Because I think now with social media, we see people saying, "Oh, we're excited to show this paper we presented," or "We're excited to show this thing our institution is doing," but you don't know what's been going on in the background. So you talked about achieving these things over time. How do you just deal with, the inevitable roadblocks?
I think again, nobody tweets, yeah, so and so just yelled at me and told me to get out of the office, unless they're just trying to make a different point. But um, the reality is social media is all about your best face, and I'm wonderful and I'm perfect and I do everything, and so it creates these false expectations. Everybody gets rejected. Everybody fails at something. And that's just part of the process. Failing is just learning. It's just a bad word for learning. Um, and so, when you get a paper rejected, most of the time the reviewers will give you useful information and your paper's better for it. If you're speaking and you do a rough, you do your first draft presentation to your team and they rip you apart, be thankful for that, because what they've done is keep you from getting ripped apart on the national stage, and they've taught you technique. So to me, all of those things ultimately make you better, but you do have to have a little bit of a thick skin. I mean, you're not going to be handheld, and you are going to fall down, and the key is to pick yourself back up. and know that everybody has done the exact same thing. They're just not going to post it on Twitter.
I just had one comment. First of all, thank you so much. I think this was a great transition, even for those of us who are going into fellowship, from a resident to a fellow. I mean, this was incredible. But thank you for saying that. I think being a mom in medicine, being a working mom, we can have guilt, because that's something that I struggle with. I have a 3-year-old, and so I do feel a lot of guilt. When I'm at home, I'm thinking about work, and does that make me a bad mom? And then when I'm at work, I'm thinking about my daughter. And so I think sometimes we're just really hard on ourselves. So to hear someone as accomplished as you say that it's okay for me to have that guilt, like, it was just very freeing. So thank you.
Good, good. It doesn't stop. Just letting you know, my kids are 25 to 39, and their problems get bigger. You can't fix them. And yet, so now you feel guilty because you can't fix them, or you try not to fix them because then that makes them less accomplished going forward. And then you think about all the mistakes you made when they were little and go, damn, I shouldn't have done that. And maybe they wouldn't be this. And so I wish I could say that guilt goes away, but I think it's just part of parenthood.
Yeah, I think you never have enough time with the kids. But one thing I try to do is try to hold myself accountable to at least one activity or one part of the week that we try to do almost religiously, because otherwise it's so easy for like days to go by and deadlines to come and go and look back and like, yeah, like we haven't made any new memories as a family. So I try to anchor myself to at least one thing. And that way every week we're making new memories, and it's sort of like that quality or
Yeah,
quantity type of
I'll
thing.
tell you, when they become preteen and teen, they're gonna turn that screw on you when they need to, and they know exactly what to feel worse about it. And my husband coached all of our kids' soccer teams. I managed them all. At one point, I had 3 soccer teams and 2 hockey teams that I was running with all my kids, and they won't remember that tournament you managed and took them to, and they'll remind you of the field trip you didn't go on or something like that when they want something from you. So I agree, making memories, trying to be present in both of your parts of your life. So when you're not at work, try and be present in your personal life. And I'm not saying that I'm on emails 24/7, even at the beach. But I crank it down a lot. And I've made that personal choice, because if I didn't, then I'd have 3,000 emails to go through, and that would hurt more. So you're going to have to figure out what that balance is. It may be at work that you carve out X period of time because that is nap time, and you want to talk to them before they go for nap, and no meetings or patients from 2:30 to 3, and that is your compromise there, whatever it may be. It's your personal integration, balance, whatever you want to call it, and you do what's right for you.
Yeah, I don't know how you do it all, Dr. Hall. How about a quick picture before we call it a night?
Sounds
And
good.
welcome anyone to turn your videos on. Okay. I'll count to 3. 1, 2, 3. Terrific. Well, Dr. Hall, thank you so much for joining us. And Shiva, I really appreciate you organizing this. I can tell from the chat here and everyone's smiles and the chats we have on WhatsApp that this is really valuable for everyone to hear. Thank you.
Good. I hope it helps. Good luck to y'all.
Good night.
Bye.